We go in at 6 seconds.
Hi, this is Remy again from Random Street Medic. I just wrapped up a patrol with Rhode Island John Brown Gun Club and Rhode Island Socialists. And what the patrols consist of is the outreach to the local homeless community. And what we do is provide food, water, necessities such as socks, hygiene kits. And I wanted to talk to you tonight about Narcan, because we had a conversation tonight with a bystander about it. And what we talked about was what Narcan does and what its function is, how to administer it, how much it is, where you can get it. So let's start off with where you can get it and how much it costs. You can get these at most pharmacies like CVS, Walgreens, Rite Aid. If you have insurance, it can cost you anywhere between nothing if you have good insurance, and if you have mediocre insurance, it'll cost you between $40 and $60. If you don't have insurance, it'll be costly about $100, $120, just depending on what kind you're getting. There are programs in different states. I know in the state of Rhode Island they have a program called PONI, spelled P-O-N-I. And what they do is they do trainings and community outreach to teach you how to use Narcan, and they provide Narcan as well for free if you go through their training. So a little bit about what Narcan is. Narcan is an opioid antagonist or an opioid receptor antagonist. It's not actually meant to reverse opioid overdoses. What it's meant to do is to assist in getting someone to start breathing again. It assists in reducing respiratory depression. And the way it does this is opioids occupy a part of the central nervous system called a mu receptor. And what the mu receptors do is they control things like euphoria. It can control, gotta wait for the music to pass. It can control respiratory drive as well as analgesia, so pain control. And when an opioid molecule occupies that receptor, it can cause euphoria, so kind of like happiness kind of feeling, a feeling of wellness and well-being. It also decreases pain, and as a side effect, it can decrease the body's respiratory drive in certain amounts. Now, if you're conscious, that doesn't mean much to you, but if you're unconscious and your body doesn't know to take a breath, it won't, and eventually, if you don't take a breath, you asphyxiate and you pass away. So what Narcan does is it occupies that receptor to prevent opioids from activating that receptor to have all those effects. So this specific one comes in a small pink box. The dosage on it is right here. It's 2 milligrams per ml. That means inside the little case and the ampule that is inside of this, there's 2 milligrams of Narcan in 2 mLs, which means that it's 1 milligram per ml in here. These come in a variety of different types. Some of them come in a big box with a looks like a little starship inside of it, and it's a single use, single dose. What you're going to do is you're going to break open your kit here. Mine has a nasal atomizer inside of it, and I'll show you how to use this in a minute. So you're going to break open your kit here, and you're going to pull out the half of the device, and you're going to pull out the device that the medication is in. So this is the Narcan ampule. What you want to do is you want to flip off this purple top, and you want to flip off this yellow piece. Now I'm not going to do that here because it's going to break the sterility of this. So what you're going to do after that is you're going to take these two pieces and you're going to twist them into each other until you get some of the medication coming out this side. You're going to pop this part off. Now this isn't actually a needle. It looks like a needle, but it's not. You're going to pop this part off, and it's got a screw inside, basically a plastic screw system. When you look at your nasal atomizer, it looks like a styrofoam cone, or more of like a foam cone, with a piece of plastic coming out of it. Now that piece of plastic clips in here, you put it straight down, and then you're going to twist it in until it locks into place. At this point, what you're going to do is you're going to check to see if someone's having an overdose. Now you should have already checked. But what does an opioid overdose look like? Well, the person might be pale. The person might be what we call cyanotic, have some blue around the mouth, or duskiness. It'll be a different color than it's supposed to be. In the nail beds, their pulse might be a little fast, or it might be slow. But the big thing is that the person isn't breathing, or they're not breathing enough. So when I say not breathing enough, usually a person wants to be breathing roughly about 12 per minute. That's about adequate for the average person. Sometimes 10 depending on what their health is. But if someone's breathing less than about 8 times a minute, or they're not breathing at all, you want to check to make sure that they have a pulse. If they have a pulse and they're not breathing adequately enough, you can't wake them, so either like a sternal rub or just a vigorous shake asking if they're okay, What you want to do is you want to have someone prep one of these. Now, while someone's prepping this, you should try and deliver a rescue breath. And what a rescue breath is, if you don't have to do this, I recommend it, because what the big deal is, you want to start the person breathing again. You're not trying to reverse the opioid overdose, you're trying to get them to breathe. So what you want to do is you want to deliver a rescue breath. Now, I recommend getting one of these down here. So it's a rescue mask. They're cheap, they don't really cost anything. A lot of groups will give them out for free. And what you want to do is you want to unfold it. It has a one-way valve on it. You want to put the mask on the patient, not on you. Then you want to deliver 1 or 2 breaths. Then you want to deliver this medication. And the way that you do this is you occlude or block one of the nasal passages, and in the other one, you're going to tilt their head back a little bit. And for this one right here, you're going to administer 1/2 into one nostril, then you're going to block the other nostril, and you're going to deliver the next half in the other one. So they're going to get one full of these into their nostrils. Now you're going to wait a moment, and if you have to, within about 10-15 seconds, deliver another rescue breath, and then after about 4 seconds, deliver another one, and take a sit back and see if they recover. It should take about 30 seconds to a minute. If within that time frame they don't recover, provide another rescue breath at about a rate of about 1 every 4 to 6 seconds is about adequate. If you don't feel comfortable doing this, you don't have to, but I do recommend it. At this point, at about 2 or 3 minutes into this, I'd recommend giving another one of these if you happen to have another one available to you. During this time, I also recommend someone dials 911 and calls for rescue, because they're going to need a professional. They're going to need professional rescue and end up in a hospital for long-term treatment. So again, thank you very much for joining me for this topic on Narcan. My name is Remy, and again, this is Random Street Medics signing out.